Welcome back to Around the Clock. My guest today, one of my guests, is Chief Davis. Chief, welcome back to Around the Clock.
Thanks so much, Yolanda, for having me back.
Our discussion today, and we've had a lot of different discussions, but our discussion today is specific to the opioid crisis that's going on in Ashland as well as the state of Massachusetts. I asked Chief Davis to come on to talk about how we're handling it and what are we doing here in Ashland to help with that. So first, can you tell us what kind of statistics are you seeing here in Ashland with either just overdoses or deaths, and start with that.
Okay. Well, as you know, back in 2014, the state declared a statewide emergency, a public health crisis for the opiate problem. And, you know, each year we've seen this problem escalate more and more and more until finally there was the realization that we're now in an epidemic. This is a crisis. So it's actually, opioid deaths have now replaced fatalities due to car accidents in the past couple of years in Massachusetts. And that problem has not escaped any community in Massachusetts, you know, to Ashland included, you know, so it doesn't matter, you know, what kind of socioeconomic background a community has or how affluent it is or it isn't, what the, you know, the makeup of a community. The opioid problem affects this, you know, statewide. It cuts across statewide, every community. And as I mentioned, Ashland is no different. So since 2014, we've experienced 27 overdoses, opiate overdoses, and 2 deaths. So obviously that's a higher number than we would want. But it is not atypical from what we're seeing across any other community that's either in our region or across the state. So, you know, then the question is, you know, what are we doing about that as a police department? And I think one of the things to recognize is, first of all, as I mentioned, it's a statewide public health crisis, so this can't be looked at as just a law enforcement problem. So the police department will never be able to figure, you know, to solve this on our own. We have to come up with a multidisciplinary strategy that cuts across all different segments to include police, fire, board of health, you know, treatment providers, recovery, you know, providers, the schools, our drug and alcohol coalition partners. It's a lot of heads working together to try to tackle this from many different dimensions. So one of the things that we did earlier on to tackle this, because we're the first ones to respond to this. We in the fire department are the very first ones to go and see that person, you know, experiencing this overdose, you know, lying down on the ground or not breathing. So the fire department had, for quite some time, used Narcan, nasal naloxone, to reverse the effects of an opiate overdose, which causes a person to actually stop breathing. So it is a life or death emergency. The only problem with that is sometimes we were there, and oftentimes we're there way before the fire department is, just because we're a little more mobile, we can get to places quicker. So we were the first on scene, and we were waiting for the ambulance with the Narcan, the nasal naloxone, to arrive. So we realized we needed to be able to have that Narcan with the officers to be able to introduce it at that very second, because obviously the earlier that we can introduce that, the greater the chances of survival for that person experiencing the overdose. So we were the first police department in Metro West to give each, you know, the officers Narcan. And since we have done that, we have used it 13 times to reverse the effects of fatal overdoses.
And when did you become certified and able to do that, the nasal Narcan?
It was early 2014.
Okay.
Yeah, so we started off with 10 doses of it, and we've used it successfully, you know, again, 13 times we've used it. So those are lives in the community that we are saving. You know, and that's what, you know, we have to focus on. These are all young people. They're all our sons, daughters, neighbors, nieces, nephews, you know, colleagues, kids. So we have an obligation to sort of all work together and to recognize that the substance abuse is a health issue instead of a criminal, you know, justice issue.
To go to that, are you finding that some of the people that you're dealing with who have these overdoses, are they first-time users? Are they addicted to something? Because one of the things that I talk about with my own children is you don't want to do anything because it can affect you the first time. So in your experience, the people that you've been dealing with, are they addicted, or is it a one-time thing, or they've just tried it?
Well, predominantly they are addicted. They
Okay.
are, substance users, substance abusers, whatever label, want to use. But they are people that have generally started off using prescription opiate,
Okay.
painkillers, whether it's prescribed to themselves or prescribed to other people, and they have obtained it,
Okay.
inappropriately. But either way, it's generally how it starts. And then due to tightening regulations on the availability of opiate painkillers and the expense of them, people who are addicted will often turn to heroin.
Right.
Because it's cheaper, it's easier to get. And so an opiate addiction often leads to heroin use. And we all know the opiate addiction actually changes the body's chemistry.
Right.
And
Right.
when you're addicted to an opiate, it's a heck of a thing to get off of.
So moving forward here in
Yeah.
Ashland, what are the steps that you, as well as the other departments, are taking to possibly address the issue that's happening here in town?
Well, we've, aside from the Narcan, we have installed a drug collection box in the police station. It's in the lobby of the police station. It's available 24 hours a day. People can come in and turn in their unwanted prescriptions. No questions asked. They just drop them off in that collection box, and then we have an arrangement with an incinerator company, and they're properly destroyed. So that is available 24/7, and we really encourage people to get unwanted, unused prescription drugs out of their house, out of the hands of potential misuse by family members or friends or visitors to the homes. Get them out and dispose of them properly. Don't throw them in your trash bucket, but bring them in to us, and we'll take care of it for them. We also have a sharps container for anyone that has a sharp, needles that want to get rid of. We have that, as well as the community center has a sharps
Right.
container also. So we have that available all the time. We also are involved with a drug take-back day on April 30th of this year.
Okay.
And that's a national initiative. So on April 30th, we will be running a campaign, and we usually get the assistance of the folks from the Lions Club and our local drug and alcohol coalition partners, Decisions at Every
Okay,
Turn.
yep.
And collectively, we run an event on
Yep.
April 30th where people are encouraged in the community to come in and basically do the same thing, bring in their unwanted
Right.
prescriptions.
Right.
But at least it's more of a marketed event. We highlight the fact. So if it's not on everybody's presence of mind during the rest of the
Rest of the year.
at least on April 30th, and we actually do one in the fall also. But April 30th, we will swing by the police station. We will collect unwanted prescription drugs and dispose of them properly. So that is one part of the strategy. Another part of the strategy, as I mentioned, Decisions at Every Turn, our
Yep.
local drug and alcohol coalition. So we work very closely with them. We meet on an opiate task force and discuss, between them, us, fire department, the schools, what kind of best strategy and prevention and education efforts would be more appropriate for the community. So we're developing those partnerships and those outreach initiatives. So there's also a couple of, legal laws that people should know about, because it helps them sort of trying to figure out the best way to
Help.
to help people.
Right.
And that's what we really want to do, is we do want to help people. So there's one is the Good Samaritan law. So typically in the past, people were hesitant if they were with somebody that was overdosing. They didn't want to call police, they didn't want to call fire, because they felt that they would get in trouble.
Right.
Well, the new Samaritan law shields them.
Okay.
And we will not arrest people that call if they are with somebody that's overdosed, if their friend is overdosed or a relative. Our goal is to help that person.
Okay.
Help that person immediately, whether it's the introduction of Narcan or a trip to the hospital, to get them the help they need for that life-saving measure. And then after that, follow up with trying to get them into a treatment bed, and
Okay.
then recovery after treatment. So it's a multi-phase, process from immediate intervention to treatment to recovery. And we can assist people as the gateway into all of those different avenues.
What are some things, if I'm a parent or a friend or a partner of someone, and what are some signs that I should look out for that might give me an indication that this person could be heading toward this kind of addiction, or they're
Towards the
in the middle
addiction?
of the addiction,
Yeah.
or
You know, any change, I always say any change in behavior, because a parent, you know, obviously is in the best position to observe their child's behavior, or even a friend of their children's, you know. So look at any changes in behavior, loss of interest in activities that maybe they were once passionate about, certainly a change in lifestyle to include friends, circle of friends. So any kind of change in their usual, trajectory, we would say is a red flag. And any unexplained, missing items in the house,
okay,
sale of items, missing, checks, money, jewelry, unfortunately, those type of things.
okay,
So, that's the other thing, is that the police are always sort of on the forefront of the aftermath of these addictions, because it's not just the addiction, the medical piece of it, but it's the property crimes that follow,
right,
along with it, because in order to support the addiction often comes the thefts, and that's where we usually get involved. But if a parent or spouse or caregiver, a guardian, recognizes that someone in that relationship has an addiction that's really interfering with their daily lifestyle, there is something that they can do. Aside calling us,
Okay.
we can provide sort of a gateway into, again, treatment, because we have relationships with Spectrum, in-house treatment, or Genesis day treatment or counseling. But also, there's a law called Mass General Law 123, Section 35. And the police use that sometimes, but a family member can use that also to petition the court, the district court, to force a family member into treatment.
okay,
And it is a process where you would apply to a district court judge and force the person to come before the court, where they would be evaluated by a physician. And if the physician deems, or the clinician at the courthouse deems that the person is in fact a substance user to the point where they can no longer care for themselves, or it interferes with their daily lifestyle, then they can be committed to an in-house program. And that is one of the tools that we have used successfully to force people into treatment.
Okay.
So we will act on somebody that's a substance abuser's behalf, and actually go to the court and petition the court to get that person into forced treatment. Because unfortunately, a lot of people, even though they're a substance abuser or addicted to it, they will not seek treatment.
Right,
So
right.
sometimes they need that coercive element, and a family member can do that. You don't have to
and how
bring
would
it
a
to the
family,
police's attention.
whose attention would the family member bring it to? How would they go about enacting that law to get their loved one help?
So they could go right to the district court and make a petition
Okay,
for a, it's called in common terms, it's called a Section 35.
okay, okay.
And they would make a petition to the district court. And so they don't even need police involvement. This can be all done without, the police involvement. But if they wanted to, we would certainly facilitate
Well,
that.
I would think that our Ashland Police Department has a good relationship with the community, that for some people it might be comforting to be able to come to the police and say, I have this issue, can you help? And I think from what you're saying, that's certainly something that, it's not that you encourage it, but you want people to know that you're here and you can help them and you can help their loved ones get help.
Oh, absolutely.
Yeah.
Absolutely. I mean, I only say that they can go directly to the court if they're hesitant to come to the police.
Right,
Either
right.
way, as long as the person's getting help, it's a win-win.
Right,
Whether
right.
it's through us, we will certainly do it, or if they can go directly to the court and do it. And actually, if they come into the police station, we actually have information on how to do that. We have this informational brochure that's in the lobby of the police station.
Okay,
And this actually has contact information for drug treatment centers. It has a brief segment on Section 35 petition and how to do that.
Okay.
And then there's contact information on the back. This is in the lobby of the police station. We actually give this to people that we know in the community are experiencing addiction problems.
Okay.
So they have this information. This was actually provided to us from District Court Judge David Kunis at Framingham.
Oh, good.
Who's from Ashland. So, but he gave us a supply of these, and there's some great information on there.
Okay,
And I
great.
would encourage anyone that's looking for that information to just stop by the lobby. It's there now.
Okay. Before I let you go, any last words to our community about this and how we can all work together to try and minimize it, or?
You know, I would just say that again, as my earlier comment, that you can't just look at this as a law enforcement or a criminal justice problem. It really is a public health issue. And it really, when it's a public health issue like this, we really need to look at all of us working together on this. And it isn't looking at getting people into trouble.
Oh, no.
It's getting people the help that they need,
Right.
and get them back on their feet and make them more of a, you know, a viable member of the community and healthy member of the community, instead of always having, you know, chasing them around and you know, and waiting for the worst. And I know there's been also some conversation about, you know, the nasal Narcan, you know, being available to family members, or, you know, making it available at, you know, to different pharmacies, which I don't have an issue with. However, people have to keep in mind, if they do use that on a friend or a loved one, that it only works for about 90 minutes. The person has to go to the hospital.
Right.
When we use Narcan on somebody, they have to go to the hospital. It's
Right.
not an option.
Right. It's
They
not just
have
you
to go.
revive them and then,
Right.
okay, they're
It
good.
wears
Yeah.
off.
Yeah.
The Narcan effects wear off, and I think
Okay.
there's been a lot of misperceptions about that it's,
Okay.
you know, it is a miracle drug, but there has to be a medical intervention and follow-up afterwards. But again, you know, we're working very hard with a lot of different community partners. It isn't just the police, it's police, fire department, the school system, the Decisions at Every Turn Coalition, the Board of Selectmen, the town
Right.
manager. I mean, we're all in this together, the Board of Health Director. We're all in this together. And we all work, you know, in lockstep to try to help the young people in this community.
Right. Okay. Well, Chief, thank you for coming on Around the Clock. I'm sure we'll be discussing more about this in the future, and hopefully it will be because things are getting better and not worse.
That's right.
Okay.
Absolutely. Thank you. Thank you for having me.
And that's this segment of Around the Clock. We'll be right back with more.